Welcome to your Employee Benefits Overview video provided by 208 Benefits. The information provided in this video is to help you understand your benefit options, pricing, and how to complete your benefit elections prior to your open enrollment or new hire completion deadline. Please watch or share this video with anyone that helps you make your employee benefit decisions for you and your family. You can refer back to this video anytime during the benefit plan year. First, let's review your benefits and then walk you through the features of your benefit information website. The Apex Electric Employee Benefits Compensation Plan has a plan year of March 1st through February 28th, so this information is specific to the dates seen on the screen. The Apex Electric Employee Benefits Package includes the following benefits: life insurance, short-term disability, medical insurance with telehealth. Life insurance benefit is provided to each full-time employee to help benefit your beneficiaries in the event of your death while employed with the company. That benefit amount is $25,000. Short-term disability protects your income if you're unable to work due to an off-the-job injury, illness, or maternity event. The benefit details are as follows. The income benefit is 60% of your gross pay paid to you as a weekly benefit. The benefits are payable on the 15th calendar day after the disability begins. This simply means that the first 14 calendar days from the date of your disability event is covered by you. And then on the 15th day moving forward, the insurer then pays the weekly benefit. The benefit duration is a maximum of 24 weeks per disability event. When you go to access the online benefit election platform, you will see your specific coverage located in the short-term disability box here. So this will tell you exactly what your weekly disability benefit is based off of the current income that you earn with Apex Electric. Now moving forward to the medical insurance plan. The medical insurer is Trustmark. And before we dive deeper into the actual plan specifics for Apex Electric, we're going to look at a few insurance terms that are helpful for you as you understand the information. First term is a copay. What is it? It's a fixed charge that a patient or member pays for a doctor's visit or prescription drug purchase. There are multiple copay options within your current plan. As an example, if you see a primary doctor in person, you pay a $40 copay for that doctor's visit. If you purchase a generic prescription, you pay a $20 copay for that. The insurer then picks up the rest of the cost for either the doctor's visits or the prescription drug and pays those specifically. The next term is deductible. The deductible is the amount that you pay out of pocket, 100%, on all healthcare costs before your insurance company starts to pay. So in this example, your plan actually has a zero deductible, meaning that the insurer will begin to pay benefits directly for healthcare services, including your doctor's visits, prescriptions, and specific other healthcare services. Coinsurance is the next term. It is what happens after the deductible is met. So this is where the insurance company begins to pay a set percentage for all insured eligible healthcare costs. Your plan, as an example, the insurer pays 50%, the member pays 50%. Next term is out-of-pocket maximum. So this is the most you pay for eligible services in a plan year. Refer back to our initial screen where your plan year ran from March 1st to the end of February annually. So the out-of-pocket maximum is going to include your deductible, copays, and coinsurance for the services. Once you've met the out-of-pocket maximum, the insurer pays 100% of your costs for all eligible benefits. As an example, your out-of-pocket maximum in your plan is $73.50 for the individual, 2 times for family. Your particular plan has a specific additional benefit called an access fee. An access fee is the amount that you pay out of pocket 100% for specific healthcare costs such as hospitalization or outpatient surgery. As example, your plan has a $2,000 access fee per hospitalization or outpatient surgery. The access fee applies to the plan's coinsurance and out-of-pocket maximum. Your plan allows you to choose any doctor, clinic, or hospital. That includes any of those that you see on the screen here, plus be able to access care nationwide without having to find an in-network provider. Your plan doesn't actually have a network, so it gives you the freedom to choose your provider based on which is most convenient, the best level of care, or even the most affordable level of care. So again, let's look at your plan summary. As stated earlier, your plan has a zero deductible, meaning that there is not any dollar amounts that you have to meet before going into coinsurance for all things with the exception of hospitalization and outpatient surgery. Your coinsurance is 50%. The out-of-pocket maximum is $7,350. This means that if a worst-case scenario, a lot of healthcare issues occurred in the same 12-month period, or a singular major event occurred that tallied tens of thousands of dollars worth of healthcare expenses, your maximum responsibility will be $7,350. Copays. So these are the fixed costs that you pay for specific services. So your primary and specialist doctor's visits are $40. Your therapy visits, including mental health, are $40. Urgent care center visits, $75. Clinical preventive services, meaning your wellness exams, those are no cost to you. You pay $0. Prescriptions. Your generic starts at $20 and then it goes up from there depending on whether you're prescribed preferred brand, non-preferred brand, or even a specialty drug. Additional copays, fees, and coinsurance. So emergency room visit has a $500 copay. Outpatient imaging, meaning your MRI or CT scan example, is 50% coinsurance. Your outpatient diagnostic x-ray or lab is covered up to the first $1,000 at zero cost to you, and then it goes into coinsurance. Now, coming back again to hospital admission or outpatient surgery, there's a $2,000 access fee per admission or per surgery. Again, that all applies to the $7,350 out-of-pocket maximum will be included in that. In addition, with all the services that we just reviewed, your plan also includes telehealth. So telehealth is the ability to talk to a doctor 24/7 utilizing your smartphone, tablet, home computer. As long as it's got a web camera and internet enabled, you can use that device to connect to a physician 24/7. These board certified licensed physicians can diagnose, treat, and prescribe medications for many common illnesses and even some minor injuries. The virtual doctor's visits are a $0 cost to you, so meaning that you do not have to pay a copay, you do not have to spend money driving to an in-person doctor's office, you don't have to spend your time driving, sitting and waiting and driving back. And there are no additional billings. So again, virtual doctor's visits are $0, and we highly recommend using this part of your medical plan as appropriate. Save yourself the money and time. Examples of non-emergency conditions that Teladoc can help you with are listed here. Simply download the Teladoc app, add your medical insurance plan information as prescribed on your benefit information website, and then save time and money on your next doctor's visit. In addition, Trustmark also provides additional member resources called Healthcare Blue Book. Healthcare Blue Book is the way to make sure that you're potentially not overpaying for healthcare and being able to select the most appropriate doctor based on quality of care near you. Procedures are not the same costs at facility to facility. Sometimes they're not even close. There could be a significant gap in cost between one facility versus another. So Healthcare Blue Book allows you to quickly look at potential costs for the types of surgeries, procedures, hospital stays, exams, etc. that you might be facing. Simply log into Healthcare Blue Book using your company code of Trustmark SB, and this will allow you to access and then search for the type of procedure that you're looking for, and then get the quality of care and pricing ratings as illustrated here. There is also a video on how this works on your benefits information website. One last benefit that's part of your additional member resources is the AMPS Member Advocacy Program. Each time that you receive care through a traditional doctor office, clinic, hospital, etc., that care is going to be billed to the insurer, and the insurer is going to send you back an explanation of benefits. Okay, the explanation of benefits is not a bill, but it does outline exactly what the codes were for the types of procedures, exams, visits that you had done, and it does outline all of your allowances, adjustments, etc., and then tells you, as example here, what your patient responsibility is. The explanation of benefits tells you what you pay for the services that you received. So it's very important to make sure that when you pay for doctor's services outside of a copay that are pre-prescribed, to always make sure that you pay only the patient responsibility amount that you receive from your explanation of benefits. Now, if for some reason you do pay your patient responsibility amount and the provider sends you an additional billing stating that they want the balance from what you paid and what the insurer paid, this is called a balance bill. The AMPS member advocacy team is who you contact when you think you may have received a balance bill, or if you know that you've received a balance bill. Speak with them directly first. Allow them to address this with the doctor's office, clinic, hospital directly, and they will take care of it for you on your behalf, and you will not owe any additional billing from the balance bill. You simply owe what your true patient responsibility is. Moving forward to prescription savings. Our prescription savings plan is separate from your medical insurance plan. Yes, your medical insurance plan does cover prescription drugs as we outlined via copays, etc. However, we don't want you to overpay for your prescriptions because we do know that we can help you save a lot of money potentially on your prescription drugs just by using our partner CleverRx mobile app. When you download the mobile app, enter the group number 1144 and enter the member number 1000. This will unlock the exclusive savings that we can provide to you for prescriptions. 40% of prescriptions that are generic are less than $10 using our app. If you refer back to your medical insurance plan information, they are a minimum of $20 for the same prescription. So don't overpay, don't pay twice as much or over twice as much for the same prescription. Simply use the app, type the name of the prescription into the app, see the list of pharmacies nearest you for their savings, select the pharmacy of choice, whether it's convenient, it's the amount of savings, or your preferred pharmacy, and then simply present your RX savings voucher to the pharmacy when you order your prescription and hand them the prescription itself. Take those savings and keep the money in your pocket. That concludes the benefits that are available to you through Apex Electric. The next steps for you as the employee is to review your benefit information on the benefit information website. You will contact 2A Benefits with any questions and then complete your benefit elections online. This is your benefit election. benefit website. It has all the information that you need to help you understand your benefits, and go to the benefit election platform. So in the first page here, you'll see all of your benefit information. You'll see your benefit tiles here showing you your disability, your life insurance, your health insurance, telehealth, prescription discount plan, all right here. As you see, these tiles are active, meaning that once you click on them, you will see additional information about your plan. Very important, your plan group number. Just in case you show up to a doctor's office and you forgot your member ID card, you can always refer to the insurer and your group number here so they can verify coverage at the doctor's office. Here's a video here that explains what premiums, deductibles, copays, etc. are outside of this video here. Your benefit summary is right here in the PDF section. Understanding your benefits further are some additional videos here. And then the mobile app for your Trustmark member platform is right here as well. Make sure that when you are enrolled, you do go directly to Trustmark and you create your member account. So you just come down here, you're a new user, you're going to create a member account. The member ID is what you will find on your member ID card. Enter that in here, your date of birth, your group number, which is on your benefit website, and then click submit. That'll give you access to your personal account information through your medical insurance. Short-term disability as an example, very similar. There's a video here, your group number, phone number, member login, your benefit summary. If you need to start a short-term disability claim, we recommend starting the claim online, as you'll see here. Simply click in that you are a plan member, what state you're located in, and then you're filing a short-term disability claim, and then continue. As you see here, again, company name, group ID, your job title, etc. All the information here to go forward. Once you've reviewed your benefit information and you again understand how to use it throughout your plan year, then you can go to the benefit pricing tab. You'll see exactly what it costs for you as the employee to be on the medical insurance and other benefits, as well as if you're adding a spouse, kids, or the whole family to your medical insurance plan. Once you've done reviewing your benefits, seeing the benefit pricing, now you'll go to enroll benefits. Simply watch this video here. This video is going to outline for you how to navigate the enrollment platform. Simple as starting to log in. You'll see either start enrollment or open enrollment depending on when you're connecting with your benefits. You'll be going through your profile, making sure that all the information in your profile is accurate and complete as to everything that is required. Adding dependents. So even if you're not going to add dependents to the medical insurance, please make sure that they're added in the platform so that they do appear on your enrollment form as waivers. This is a requirement for us to process your medical insurance. So here you're simply going to select what you're going to enroll in, view your plan options, and as you see, once you make that benefit elections, it populates your shopping cart for you. Add your beneficiary information. It's very important to make sure that on your short-term disability or life insurance, if something were to occur, your beneficiaries can be notified. You can update your beneficiaries anytime. Once you've completed all that, you'll see a benefit summary. You can print that benefit summary, but do not stop here. Continue and go to the sign form sections where it's going to have you create your signature by first typing it in, then signing, and then applying it to each of the forms for you. We never send you home with a bunch of paperwork to fill out. We let the system do it for you. Now that you are finished with that, you'll see that you are 100% complete. You can click finish. You can add any additional information, a star rating, and so on. Once you're complete, you will see your benefit statement here. And then you can simply log out. Now that you've completed your benefit elections online, we'll also make sure that you're aware that there is an enrollment deadline. The 15th of the month prior to your benefits eligible date is your benefit deadline. Please ask Apex Electric for your benefit eligible date. It is based on your date of hire. Thank you, Apex Electric.